hospitalizations in the month of July. So that's a sub-segment of data slightly better and different than what I talked about for the Banner Health roll-up and what we're seeing in several of our counties here in Arizona. As far as what you should look for in your own locale is percent positivity of what the tests are showing and what the hospitalization rates look like in your own locale. Again, we'll ask everybody to continue to do what we know is the best way through this pandemic. Please get vaccinated so that our hospitals and our other care delivery sites can maintain as much of our normal operations as possible, because it is our desire to take care of everybody who needs us, both COVID and non-COVID.
Peter Samore with KTR News here in Phoenix asks, what are patients and visitors telling you about tighter reimposed restrictions at Banner facilities?
So as I stated in my opening comments, we are tracking all of this at a county level, and we are doing it and making those changes on a weekly basis as we look at the data. The most recent restrictions that we put into place for those 3 counties that I mentioned here in the state of Arizona just went into effect this week. So we're looking forward to continuing to work very closely with our patients and their friends and visiting family to make sure that we can keep everybody as safe as possible and yet make sure that we're following what is emerging out as far as increase of COVID cases.
Christina Duran from Tucson Local Media asks, how great is the concern that hospitals would face a shortage of ICU beds with this growth in COVID cases?
So, I think that's always a concern if you take a look at what's happening in other parts of the country. Some of those states are really experiencing very low vaccination rates amongst their communities. And of course, they're then experiencing significant increases in both ICU and total hospitalization rates. It is our sincere desire to not have us at Banner Health or any of the states where we operate get to that point. And we now have tools available to us that we did not have during our previous major surges. That is called vaccination. Please, if you have not yet got vaccinated, go and do so as soon as possible so that we can make sure that our hospitals, our clinics, our emergency departments, and everywhere else where you, a family member or friend may need care is available and open to you.
Cheyenne Moreno from KOLD News, Channel 13 in Tucson asks, are you closing down or minimizing some areas of the hospital to dedicate them as new COVID wards? So that's the first question she's asking.
So at this time, we have not reduced any of our services. We are open and a safe place for everybody to come and receive care. We are, just like we do during lots of different parts of respiratory seasons in winters past, flu season and things like that, we do adjust where we sometimes put our patients. We are beginning to do things that we did during previous surges where we will be cohorting our COVID patients into particular wards. But again, everything within our hospitals remain open at this time. We are here in a safe place for you to receive care if you need us.
The second part to that question about dedicating some areas as new COVID wards, she would like to know if that is the case, how many, where, and when can the public expect that?
So we do that, sometimes honestly on a day-by-day, shift-by-shift basis. And if you are a patient, of course, you will be instructed on where you are going and what your diagnosis is. So if you are a suspected COVID patient, you will be informed of that. And of course, we will tell you where you are going to go and receive care. If you are a visitor, we will help when you come to see your loved one or a friend, make sure that you're appropriate to come visit, meaning that you don't have any symptoms and you're masked up appropriately, and that we're following all of those guidelines. So we will help you when you come to either receive care or visit somebody, make sure that you're following all the appropriate protocols and know exactly where you need to go.
Andrew Favacad, I apologize if I'm mispronouncing this last name. He's a reporter with the Arizona Republic, and he's asking 3 questions, so I'll start with the first. What is Banner seeing in terms of kids in Arizona getting sick with COVID, as well as other viral or bacterial infections?
Yes, thank you. I'm just going to refer back to my notes. So currently, pediatric patients account for about 5% of all of our COVID hospital admissions. Similar to what is being seen across the country, we have seen an unusual surgence of RSV disease within our pediatric population. It is an unusual time for us to experience that type of surge, and that makes us concerned about the upcoming winter. Again, I'm going to go back to my opening comments of what all of you can do to help make sure that our kids and our pediatric populations are safe. If you're age eligible to receive COVID vaccine, please go and do so as soon as possible. We have many children under the age of 12 who are currently ineligible to become vaccinated. They are protected by the rest of us getting vaccinated so that we do not unknowingly transmit COVID to our pediatric children and patients.
And Andrew's second question, what are the trends for kids with COVID looking like in recent weeks?
Can you, what are the, what
the
kind?
trends?
Oh, the trends in kids looking like in
COVID looking like in recent weeks.
Thank you. So again, going back to my opening comments, currently pediatric patients account for about 5% of all COVID hospital admissions for us here. And we are beginning and have been experiencing an RSV spike, which is, again, an unusual time for us to see that in the pediatric population during the summer months. We will continue to follow those trends and in upcoming briefings bring you additional data as it emerges for us.
Another question that Andrew asks, are you seeing more RSV cases and kids with other illnesses as well?
So yes, so as I stated in some of my answers previously, we are seeing more RSV cases at this time. I can bring additional information at an upcoming briefing with you as we continue to monitor that trend.
And his last question, what should parents keep in mind for keeping their kids healthy?
So yeah, it's such an important question at this time. So a number of different things that we can all do, not only just parents, but all of us can do to make sure that our children are being kept as safe and as healthy as possible. We know that children are going back to school right now, and so that obviously brings some additional factors into the equation of how we can try and keep them healthy and safe. Number one, if you're age eligible to receive a COVID vaccine and have not yet been vaccinated, please do so as soon as possible. The rest of us can help keep those children under the age of 12 who are ineligible to receive COVID vaccine as safe and healthy as possible. Number two, follow CDC guidance, which was recently released that when you're in an indoor setting with people that you cannot physically distance from, that you should go ahead and mask up. Number three, when you're out and about, if you're going to work, if you're going shopping, please do not do so if you are feeling ill. We know that many patients who are getting the Delta variant may have very mild or sometimes even asymptomatic illness. If you think you have mild symptoms, please do not go out and about. Get yourself tested. And if you test positive, make sure that you go ahead and appropriately isolate from everybody until you start feeling better and have gone through the appropriate days of isolation. We can all do our part to make sure that everybody is as safe and healthy as possible, but especially those children who are ineligible because of their age to receive vaccine at this time.
Thank you. Next question comes from Claudia Rupchik over at ABC 15 here in Phoenix. This is a two-parter, so I'll ask you the first one. You mentioned some alarming statistics in the beginning about increased use of ventilators since July. What is the status of available ICU beds, ventilators, and resources at Banner Health?
So at this time, we are a safe place to receive care and we are open. At this time, we have adequate room, both in our ICUs and our hospitals and with ventilators to care for anybody who needs COVID care as well as any non-COVID care. The purpose of today is to bring you up to date with the trends that we are seeing and asking all of you to help us to make sure that we can maintain that openness for everybody who needs care, both COVID and non-COVID. Again, don't go out when you're ill, mask up when you're indoors, and if you haven't been vaccinated, please get vaccinated as soon as possible.
Claudia's second question, are we anywhere close to what we experienced last year?
We are not yet at this time close to the peak that we experienced both in July and January, the two previous largest surges that we saw here. However, the slope of what we're starting to experience looks very, very similar to the exponential growth that we experienced during those two very large surges. However, we have a new tool available to us to make sure that we do not get to that level of surge, and it's called vaccine. Please get vaccinated as soon as possible if you are not already vaccinated against COVID-19.
Emily Carmen from Arizona PBS asks, should vaccinated persons be getting tested regularly for COVID-19 or only if they get symptoms?
So at this time, it is recommended that if you're experiencing symptoms that might be representative of COVID, that you go ahead and get yourself vaccinated. That's whether you are, I'm sorry, you go ahead and get yourself tested, whether you are vaccinated or not vaccinated. It's important so that if you happen to have COVID-19, that you can go ahead and appropriately isolate yourself so that you do not continue to spread that perhaps unknowingly to other individuals. We know that there are breakthrough infections that are occurring with those that are vaccinated, and so it is possible that you could still get COVID and you could still potentially spread it to others. So if you are having symptoms, go ahead and get yourself tested.
Next question comes from Frankie McLister. He's with KTVK KPHO here in Phoenix. Hi there, Dr. Bessel. I'm wondering if there's anything you all learned from during previous surges that you will be implementing or doing differently across your facilities here in Arizona during the surge.
So we learned a lot during our previous surges. Again, COVID-19 during some of those surges was very new to us. It was very early in the part of the pandemic, and we learned a lot about how best to care for those patients, how best to manage our hospitals, how best to make sure that we were there for everybody who needed us, both COVID and non-COVID. So we will continue to put into play all of those things that we learned during those previous surges. The one thing that's very different this time, and I cannot overemphasize it enough to all of you, is that we now have vaccine available to everybody. And so again, that is our way through this pandemic. That is the way for us to not have a huge surge like we had previously, is to get as many of us vaccinated as possible. So please do your part. If you're not vaccinated, get that done as soon as possible.
Terry Tang from the Associated Press asks, are you hearing any stories from doctors and nurses at your Arizona hospitals of COVID patients saying they wish they had gotten the vaccine?
Yeah, we're all hearing those stories, and many of you have seen those in other media that has been released across the country, and it is absolutely heartbreaking when somebody comes in and becomes critically ill with COVID who is unvaccinated. Again, I'm going to go back to the previous statistics that I said in my opening comments, which is that 97% of COVID hospitalizations and 99% of deaths in this country are amongst those that are unvaccinated. It's a very sad story when you see people come in who had the opportunity to get vaccinated and did not do so and then become critically ill. We're here for you, but we ask you to please get vaccinated. We'd much rather that you get vaccinated and not become ill and need our services. Please get vaccinated if you have not yet done so.
Josh Sanders here at 12 News in Phoenix asks, you mentioned a 95% increase in COVID-19 patients and 300% increase in ventilator usage. Alarming numbers. How many of those patients are pediatric patients?
I do not have those statistics exactly at my fingertips. We can get those to you afterwards. I'll just go back to my opening comments that overall pediatric patients are accounting for 5% of all of our COVID hospital admissions, but we can get some follow-up information to that question. Thank you.
And Josh did ask a follow-up question. Do students need to wear masks in schools?
So I am going to continue to advocate for what the CDC has as guidelines out there for all of us to stay as safe as possible. So it is CDC guidance that children that are in school should be masking up.
Peter Samore, KTR News here in Phoenix, asks, what do you tell the vaccinated who don't want to wear masks, especially if they feel punished for getting vaccinated?
Yeah, I know it's very difficult, at this time, and disappointing that we are at this phase of the pandemic. And I feel those sentiments for those of you that are out there listening. I would just remind all of us to think about the decisions that led you to get vaccinated. Hopefully it was to protect yourself, but also part of that, I hope, was for you to be able to protect others. And that's what masking up indoors now for those of us that are vaccinated is all about. Give a little bit of additional layer to protect yourself, but also help protect others who are still yet unvaccinated.
Claudia Rubchik over at ABC 15 here in Phoenix asks several questions, so I'm going to read the first one to you. If these trends continue, what is the biggest concern?
So, as we stated in previous parts of the pandemic when we were headed into surges, the biggest concern is that you might get sick. The biggest concern is that somebody that you love or know might get sick and potentially die of what is now a preventable illness. We do not want that to happen to you or anybody that you know or anybody that you love. So please go ahead and get vaccinated. The second part of the concern is that as those surges happen, they overwhelm our hospital systems and our medical care delivery systems. We do not want that to happen because we are here to take care of everybody, COVID and non-COVID. Surges reduce our ability to allow everything to remain open in the way that it normally is. So please go ahead and get vaccinated if you have not yet done so.
The second question that Claudia asks is the only solution to get a certain percentage of the population vaccinated.
I'm sorry, could you restate the first part of that?
Sure. Is the only solution to get a certain percentage of the population vaccinated? I think what she's asking, so
to prevent a surge?
Yeah, if these trends continue, what is the biggest concern? What would we'd asked you first? And then is the only solution to get a certain percentage of the population vaccinated?
In short, yes. Vaccine is safe. It's been proven to be highly effective. And that is the tool that we have available to us at this time to prevent people from getting ill, needing hospitalization, coming into our ICUs, and ultimately dying from what is now a preventable illness.
Next question that Claudia asks, many health experts say we won't reach 70 to 80% vaccination rates. What will this mean for us?
So the future is still within our own determination. And so again, if you haven't yet been vaccinated, please go ahead and do so. But I do think that looking at the science of what has unfolded throughout the pandemic is that it is likely that this virus is going to stay with us for a very long period of time, which means that we will just continue to have people who get ill from this. The goal is to reduce that to as much as possible, to maintain our hospitals and other care delivery points of care open for everybody. So again, please do your part. Go ahead and get vaccinated.
Next question comes from Cheyenne Moreno, KOLD News, Channel 13 in Tucson. She asks, are elective surgeries still going on as normal? If so, is there any preparation to restrict them as cases continue to rise?
So we have not made any changes to our elective surgeries at this time. We continue to watch what is happening to hospitalizations, utilization of our ICU beds, utilization of our other beds within our hospitals. We will continue to adjust as needed to make sure that we are open, available, and a safe place for care. We certainly hope that that does not happen, and we ask all of you to do your part to help us not get to that point. Please get vaccinated.
Christina Duran from Tucson Local Media asks, how severe are hospital pediatric COVID cases?
So I'm going to say that we're going to follow up with that. I don't have that level of detail. I'll go back to my opening comments where I stated that pediatric patients currently account for 5% of all of our COVID hospital admissions. We can get some additional breakdown at a later time for you. Thank you.
Thank you, Dr. Bessel. And that looks like that is conference. Thank you all for joining us this afternoon. As a reminder, a high-resolution video, transcript, and any materials shared with you during this press conference will be available at bannerhealth.com/newsroom. Please allow 2 hours for us to post all these materials. Please send any follow-up questions that you have to media@bannerhealth.com. Thank you.